Welcome to the School Mental Health Minute. This is a weekly webcast that focuses on mental health and school issues for children and adolescents. We'll highlight some of the newest research findings and translate the impact and implications of these findings. All this in a couple of minutes. I'm Dan Florell, and let's see what this week's study has to offer. We're featuring a journal article this week titled Sexually Explicit Cell Phone Messaging Associated with Sexual Risk Among Adolescents. The authors of this study wanted to know how sexting is associated with sexual health issues. They defined sexting as image or text messages that were sexually explicit. The study surveyed 1,700 high school students in California. The authors found that 15% of high school students reported sexting and 54% knew someone who had sent a sext message. Those who knew someone who sent a sext message were more likely to engage in sexting too. This points out how sexting behavior is related to group norms. If students see other students sexting, then they're going to view it as normal behavior and be more likely to do it too. Of the various groups studied, African Americans and LGBTQ youth were more likely to sext. While sexting has been viewed as a safe alternative to actual sex, this study found that students who engage in sexting have a higher likelihood of physical sexual risk-taking. The takeaway is that sexting is not a harmless alternative to physical sex. It likely sets up situations where sexual activity becomes more likely. When parents or professionals talk to adolescents about sexual activity, sexting may be a way to lead into the topic. That concludes this webcast of the School Mental Health Minute. Come back next week, and thanks for watching.